I want to stress on the issues of drugs and substance use because it's becoming rampant, and especially with the young people, with the new novel products that are coming up. And here in Kirinyaga especially, we had seen a spike in regards to drugs and substance use, whether it is in terms of bang, the electric cigars, porches, and just the local brew. We want to emphasize and seek the church that we join hands so that we are able to speak to our children, we are able to speak to our families so that we do not have people suffering out of drugs and substance use. Remember, these are products that are very detrimental to our health. We have seen many people get cancer of the throat out of the novel products and out of cigarette smoking or nicotine, use of nicotine especially. So we want a reduction in the same. Just last week we were having the World Breastfeeding Week, and we emphasized on exclusive breastfeeding for the first 6 months for the nutrition of our children. We have seen a drop in mothers breastfeeding in the recent past from 62% to 60%, and we have also seen a spike in the use of bottled milk from 20% to around 34%, meaning most of some of the mothers are not breastfeeding at all, and they are using maybe expressing milk and putting it in the fridge and leaving the children to use the bottled milk. So we want to emphasize on nutrition, nutrition, so that our children can have their grow well and their cognitive growth can also be at par. Matters health, matters public health is a public health concern, and we want to emphasize on the good spaces, especially the Epuka Uchafu Afya Nyumbani initiative, where we have 7 counties that have already initiated or taken a step in the initiative. Counties like Migori, Kisumu, counties like Tharaka Nithi, and in the future we are looking forward to having all the counties take up this initiative to ensure that public health issues are taken seriously, both at home and at work. The affordability of healthcare is very key. And as the law states that level 2, level 3, and level 4 outpatients must not charge. And that is the law. It is not a matter of guesswork. That is what the law states. So anybody going to our facilities, and that is what never used to be there in NHIF, should be able to, anybody going to facilities should only have registered, and especially for outpatient. And if you're referred to another facility, then you're required to pay for SHA, for referral system, or if you're admitted. Therefore, that is affordability of our healthcare. We also want infrastructure system that has much dignity, and especially for our mothers who are giving birth. We do not want mothers who are just put in a hall. We want them to be in spaces where they have some privacy and they are able to labor and give birth in a decent manner.